Thank you very much, David. We're very pleased to be here. And I think, as you said, these statistics in this situation are staggering and very disturbing. So, Margaret and I are here today to release this study. We have just completed an in-depth, qualitative, peer-reviewed study designed to understand the day-to-day lived experiences of long-term care staff who are facing violence on a regular basis from residents and family members. Over the course of several months, we spoke at length with dozens of long-term care staff in communities across Ontario, including in the Toronto area. We learned that direct resident care is carried out predominantly by personal support workers and registered practical nurses, the majority of whom are women and many of them racialized. We also learned that the problem of violence has been largely hidden from the public. Long-term care staff feel that they are at risk of being blamed or targeted if they report incidents or violence to their employer, and they fear discipline or dismissal if they speak publicly about what happens to them at work.
So we began each group interview by asking participants to show us how violence at work had affected them personally by applying stickers to body images. We had large body images posted on the wall and had people come up and put stickers on, bigger stickers for more major injuries and small ones for minor injuries. So this was just from a group of 4 people. It was a way to get them to introduce themselves and to start to talk to us about how violence is affecting them. So stickers applied to the groin, breast, and buttock areas represented groping, touching, grabbing, or sexual assault. They talked to us about what these dots were, about the occasions when this had happened, how they felt. The arms and face were shown to be common targets for slapping, grabbing, spitting, scratching, or wrenching. Stickers on the head represented blows resulting in minor injuries to serious concussions. We had one PSW come into a group interview with sunglasses on and a cap. We had to keep the lights off. She was still suffering from the after effects of a very serious concussion. As the people we described interviewed what their stickers were for, we heard about a wide range of physical assaults resulting in bruises, burns, scratches, and fractures. So here are in the words of some of the people who attended the group interviews. On a daily basis, I'm hit, punched, spat at, sworn at, slapped, bitten. I've had hot coffee thrown at me. I've gone home with burns on my hands. I'm still having issues with my eye. I was hit so hard in the ear I couldn't hear afterwards. I was just fixing his shoelace and he punched me in the back of the neck. I didn't see it coming. He grabbed onto my breast so hard I didn't know how to get him off, but pulling made it worse. My breast was black and blue. I put his pajamas on and went to tie them. Then I saw his fist. Oh my God, here it comes. Pow, right in the mouth. It cracked all my teeth and broke my nose. The stickers in the cloud above the head represent stress, burnout, anxiety, depression, and fear. They talked about how sexist comments and sexual touching leave them feeling hurt, angry, and demoralized. One of them said, "It's degrading. There are times that you just sit down in your car and cry." Another said, "He groped me when I was bathing him. It bothered me for a very long time, but I didn't dare say anything because I was worried about my job. I was a single mom and I had to work." And many endured hurtful racist and anti-immigrant comments. She had a southern drawl and used to say, "Oh, you, I had slaves like you." "Oh, an immigrant, where did they find you? Downtown, brought you here?"
Almost everyone said that they have been told violence is just part of the job. But there is plenty of research that proves that violence can be prevented. The conditions under which staff are working and residents are living and being cared for breeds aggression. Our long-term care system is underfunded and understaffed. Efficiencies and time studies have reduced the people in care to little more than objects on a production line. Care is rushed and there is little time for making emotional connections with residents. This not only has a direct impact on residents' quality of life, it also contributes to their frustration, fear, and confusion. We were told, of course the residents are agitated because there's no time to spend with them anymore. And they're not machinery. We're not dealing with car parts. We're dealing with actual human beings that can't be rushed and that deserve better than what we're able to give them. We conducted this research to examine the problem of violence against staff. We learned about so much more. We discovered a system that is at a breaking point. The staff are at a breaking point. Additional financial support must be provided by the government, and upgraded minimum regulatory standards for care must be instituted. And abused staff and family members need to be held, abusive staff and family members need to be held accountable for their actions.
So after doing this research, we strongly feel that we cannot allow the issue of violence against long-term care staff to remain hidden from the public. As a society, we encourage women to speak out against physical, verbal, or sexual assault. But if those victims are healthcare workers, they're told to be quiet about it. This repressive and unsupportive practice can add further insult to injury, add further psychological harm to already traumatized victims. Many victims of assault need support in order to carry on with their lives without being continuously dragged down emotionally by the trauma they've experienced. Trivializing or dismissing such incidents as unimportant or just part of the job can compound the sense of victimization and debasement an abused individual can feel. Long-term care staff need to be protected and respected and allowed to speak out about what they believe is needed. Legislation can help with this. A bill has been introduced provincially by MPP Franchelina that would provide protection for healthcare workers who report violence. Legislation is also needed that would require a minimum of 4 hours of care per day, preferably more, in long-term care, which would of course necessitate additional staffing to achieve. And a bill has been introduced at the federal level by MP Don Davies to amend the criminal code to recognize violence against healthcare workers as criminal assaults as it does for transit workers. Adopting these legislative protections would be important steps towards addressing the epidemic of violence against long-term care staff.